Hi, I'm Hamsa. I'm the founder of Inoviva. Inoviva is building a healthcare platform to connect health seekers to healthcare practitioners. As part of our pre-launch, we are interviewing renowned doctors who have created great value and impact in the field of healthcare. We have with us today Dr. John Glover, who is also a medical advisor for Inoviva. Inoviva team would like to thank you for giving us this opportunity to interview you today.
My pleasure.
I would like to begin by first asking you a very basic question. Can you explain briefly about osteopathy for the benefit of those who may not be familiar with this particular type of medical practice, osteopathy?
I'd be happy to. Osteopathic medicine, and early on was referred to typically as osteopathy, grew out of the work of a physician, a rural physician in the Midwest in the late 1800s. And basically, at that time, pharmaceuticals were not well regulated, and they tended to be opium-based medications with herbs in them. They tended to be narcotic-based things, tinctures. Things were not well regulated, and there were a lot of things that basically did more harm than good to patients. Very few of those drugs that were used at that point are still used today. Surgery was also in a fairly primitive state. So as a physician working on the frontier, he basically came to the point of realizing that many of the things that he had learned to use for treatment were not effective. And he basically went back to ground again and said, what is it that are the most important things about health? And felt that the individual themselves had a natural ability to heal themselves, felt that the normal functioning anatomy was the most optimal at keeping and maintaining health, and worked to optimize the function of the individual through correction of musculoskeletal problems and how that affected their health. So from that period in the late 1800s until now, he was an MD in his day, and he started an osteopathic school in the late 1890s, and that has grown and expanded now into approximately 36 colleges around the U.S., and there are a number of colleges around the world as well. So basically, an osteopathic physician today, there are two types of physicians that have a full spectrum license, meaning they can prescribe medications, do surgery, take extra training in surgery or in pediatrics or in family medicine in a number of areas. So an osteopathic physician is like an MD in having a full spectrum license, is like an MD in terms of having 4 years of medical school approximately, and then going on to residency training after that time and going into practice. The biggest difference is that during the first 4 years, osteopathic medical students receive extra training in the musculoskeletal system, using their hands to diagnose and treat all kinds of problems throughout the body. So that's probably the biggest difference.
Oh, that's really, really interesting. So do you think osteopathy does it concentrate just on musculoskeletal issues, or do you think most of the issues start from musculoskeletal disorders?
There's always a musculoskeletal component to any disease entity. So it doesn't matter whether you're talking about asthma, whether you're talking about low back pain, whether you're talking about a bowel disorder. There's a musculoskeletal component, and that may be because of a neural reflex between the organ system and the central nervous system, or vice versa. It may be because of blood flow in terms of impedance of blood flow and decreasing the health of tissues. Maybe for a variety of reasons, but musculoskeletal problems, because they occupy the major mass of the body and also are intimately related in motion, locomotion, working the system as we get up, move through the environment, think, and act, are critical in terms of staying healthy. The part that is probably the easiest for most people to understand is most people are familiar with chiropractic or with manipulative work of some physical therapists, other professions that use their hands for diagnosis and treatment, and they're typically used to things that are dealing with purely musculoskeletal problems. Neck pain, low back pain, shoulder injury, a knee injury. In addition to those purely musculoskeletal things, manipulation can also affect the health of other organ systems. For instance, the GI system. If the GI system is not functioning well after an abdominal surgery, for instance, there are manipulative works that can be done to help to stimulate the bowel to start moving again so that you can leave the ICU or leave the surgical suite and go home. Or in terms of working with asthma or a number of other conditions. So the possibilities of using your hands for diagnosing and treating are wide-ranging. It can affect basically any system. It doesn't mean they can cure anything. It means they can have an effect, and the effect depends on that problem in that individual.